and health.
Okay.
It's one of the areas that has been overlooked, especially in our parts of the world. So we are going to see how the kind of houses in which we live can impact our health.
Okay.
So this is the table of contents. We are going to look at what it means or what the concept healthy housing means. And we're also going to see housing as a determinant of health. We're also going to see how housing and infectious diseases interplay. And we also see how it impacts chronic disease as well as injuries, nutrition, mental health, and we'll look at the way forward. Yeah, I think this definition is okay. Says healthy housing is a shelter that supports a state of complete physical, mental, social well-being. In other words, if you are in a house and it doesn't support your health because the complete physical, mental, and social well-being represents health. So if you are in a house that does not um, help your health in terms of these areas, then the house is not healthy or it's not healthy housing. And I think this definition is coming from UNDP. And it's healthy housing provides feeling of home, including a sense of belonging, security, and privacy. Healthy housing also refers to physical structure of the dwelling and the extent to which it enables physical health, including by being structurally sound, by providing shelter from the elements and from excess moisture and cold. So, so in some cases, you appreciate that some buildings have not been constructed in a way that supports the physically challenged. So that in that sense, we can't classify no matter how beautiful that place is if it lacks systems or structures that make sure that people are able to stay healthy, or it prevents injuries and all that, then it cannot be considered as healthy housing. Sometimes some rooms can be very hot, even when the weather is cool and rainy season, because of the structures. Sometimes the the, the, the structures in itself, as we move on, you appreciate how even mold can affect our health. Those building stuff on the building can affect our health. So I think this is a diagram. They are meant to promote health by addressing housing toxic materials, overcrowding, indoor air pollution. Yes. So from these diagrams, I think, like the saying goes, a picture worth 1,000 words.
Yeah.
So from here we could see that right from the roof, asbestos. I mentioned last week
Last week, yeah.
that even last week, yes, the asbestos can also induce, how do you call it, cancer and asbestosis. Right from the roof to even the paint, the number of people in the room. Typically, you go to a place like Choco, you find 20 people in a small room that is as big as someone's kitchen. And you find about 20 people lying there, small bed, 3 or 4 people lying on the bed, some sleeping on the floor, and some, it's polluted. So once someone has an issue, it is easy for it to spread. When in my days in University of Ghana, a room that was meant for about 3 or 4 students, you find about 25 students sleeping in their bedroom. And for some of them, when you wake up and you are going to lectures, that's when they will come around to sleep on your bed. And even when they are coming to lie down, you don't even know what they have that they are coming to lie on your bed. Yeah, and sometimes too, you have harbor all sorts of chemicals in the room, like petroleum products, gas, kerosene, all forms of dangerous chemicals. Sometimes we just keep them. Sometimes within the reach of children. And in some cases too, you find that people use sources, like coal pots indoors, basically things that generate, air, bad air or air pollution, like all those gaseous matter, in the room, and the room is sealed in a way that they can hardly escape. So once you do that, it exposes you to other things, triggers certain conditions, and the indoor temperature too is another factor. So some people, the rooms are so stuffy that they become sick. And in some cases, too, you realize that there are some rooms, even sometimes, even not necessarily the design of the house, but sometimes we want to, uh, we arrange, sometimes we arrange our room in certain ways that, let's say, when the light goes out, someone can just, and all those things can cause issues. Sometimes someone spills water. Can you hear me?
Yes, sir.
Yes, someone spills water and doesn't clean it, and it becomes a ground for accidents. So a lot of things can happen in our um, housing that compromise our health. So basically, that's what this diagram is looking at. And there are some choices. Healthy housing is becoming more important in light of urban growth. Yes, so clearly, when you look at East Legon, and you realize that with time we are replacing um, we are seeing more designs that allow more space in the room, more ventilation and all that thing. They are very important because when you walk outside, the pollution is so much, and you should come home to, and you have all this, health hazards around you. You are going to die early. You die before your time, and we are increasingly to people are growing. If you look at the age structure or the life expectancy. I think the last time someone mentioned 55, or is it 65? Is it 65 or 60? Okay, 66, around 66. So Ghanaians are, living longer, and of course, once you have this, aged people around us, if the environment is not safe, they at a point, for me, for instance, on two occasions, I was, I was so disheartened, when I heard my mom had slipped and fell because the ground was muddy, was slippery, and
Oh,
it happens in Accra. In Accra, for instance, in Accra, we are fortunate to have a lot of roads, but there are in some cases that where, it's the rain falls and the old person is not in the car. Imagine how the person will have to stress to get to the roadside to get the car and then back. And sometimes we have to fight for trotro with them and all those things. So it's high time we change, the structures around us, especially where the housing in which we live. So this is a picture of where some people live, and
hey.
this picture is not, yes, there are worse pictures in Ghana, some place in Temako Zigisho. Even this one cries. It's like East Legon compared to the Zigisho situation. Yeah, people living. It's like people living in a dump site. And when it rains, you only see them put wood or planks, and they walk over them. And you see mosquito breeding, the black, green, and people are in these wooden structures, kiosks. Even these parties, they've raised the building small, you see, and it's something else. And you have people living a condition like this. So, and once you live in such conditions, you find that there will be disease breakouts. You have, because the cholera and most infectious diseases. Because once someone have chronic illnesses, injuries, poor nutrition, and you marvel. Having your housing can determine how whether you have a mental health issue or not. In Accra, apart from even having the housing itself or having a place to live in, thinking of rents is an issue. And even when you get the housing, times like this that it is raining, by now people's buildings are flooding, and you can imagine what they are going through. Recently, I heard of this popular musician, Stella Sil or Stella Dugan. Yeah, she had to join a relative because her home was flooded. So and she had lost lots of things, amounting to millions of cedis. So you can imagine. And, people. So the housing is a very big issue that can affect, and as well as injury and chronic illness. And with time, we get to know how our housing affects chronic or non-communicable diseases. So exposures and health risks in the home environment are critical because of the large amount of time. Yes, and at, yes, so largely people spend a lot of time in the house. So taking for example, if you spend 8 hours in the office on a typical weekday, all things being equal, and let's say you spend about 4 hours going to work eh, and coming back, that's like even 12 hours. So largely the remaining 12 hours, where would you be? Likely you'll be in the house. And for some people, their working places are nearby, so it's just a walking distance. So after the 8 hours, you realize that they are spending about 16 hours indoors. And recently, as part of the lockdown, we had to stay in the house all day, and you could hardly step out of your house. So you are going to be in there. So if there's a dangerous element like your roofing is asbestos, and every time you are living under that asbestos, just imagine how that exposure is going to affect your health. Because I think last week, one of the things we looked at is the fact that how long you're exposed to the hazard as well as the level of concentration can and yeah can impact your health. So the length of time is also a determinant of how housing can affect your health. So in income countries, around 70% of people's time is spent inside home. And yes, it's believable because a lot of people, during winter, do not go to work, especially those who can work from the house. They just have their systems installed in their homes, and so they end up spending more time at home. And because it's winter, too, they have to set fire. And if your chimney or system is not in good shape, you can imagine the amount of smoke that will be in the house. So they said housing as a determinant of health. So looking at the chart, the pie chart on the left, it says support from family, friends, income, 7% housing, positive mental health, healthy lifestyle. Oh, okay, so I think they are looking at the determinants of health. Mentioned access to health services, healthy lifestyle choices, your positive mental health and wellness, and housing constitutes 2%. So if you are talking about your health, and the or how do I even put it? Housing accounts for 2% of your health. So it means that housing, it may be small, but it's significant. So your income is also an issue. So you see, income is just 7%. So it means that yes, and housing is 2%. So support from family and friends. Okay, well, so you're also saying housing, stigma and discrimination, access to healthcare. So they all impact each other. So where you live can also influence whether you be poor or not. And in some neighborhoods, when once you are living there, some they have a certain mentality. And
Yes.
hello, is someone on the line? No, okay. So your housing can impact, make you poor or rich. We can also look at house, and at the same time, poverty can also determine the kind of um, house you live in. Because if excuse me, say your earning a month is around 300 cedis, I'm not sure you can afford to spend all the 300 cedis on a 300 cedis apartment. An apartment costing 300. Most likely you want to go for 100 cedis or 150 cedis. In such cases, most of the time, the such are not that so conducive, or sometimes you may have to even share toilet washrooms with other people, and you have no idea what your fellow tenants are having conditions that. And I was just imagining that with this COVID thing that government wants us to be home, we shouldn't go anywhere and all that thing. You go to a place like Kisema and you have where you have people queuing for a toilet, and you wonder. Yeah, so it's just high time we just work hard and then get a housing or structures that we can have everything for ourselves, that we don't have to be sharing things with people like that. You don't have to queue so much for to use the washroom, the toilet, and the bathroom. And there's this thing that I think government started and people are not taking it seriously. But I want you to help with that campaign. The campaign that if you are dating and you don't have a toilet in the house, the ladies shouldn't consider you.
Oi.
I think it's yes, the ladies shouldn't consider your proposal when you are living in a house that doesn't have toilet facility. Because when she comes to visit you, what do you expect her to use? Yeah, so it should be a criteria for selecting your tutors. I
Interesting.
think it's a
Mr.
very good.
Sifa,
Yes.
I want to ask a question.
Oh, feel free and ask.
Okay, so
Yes.
which kind of toilet are you talking about? Is it the bedroom one or the one outside? Or
Why with
should
the
it be a
queue?
self-contained
At
house?
least no. At least your house, if it's even a compound house, you should have a toilet facility in it. If it is not like self-contained and it is in your house, fine. But there are some households that do not have toilets. So sometimes they have to go in the bush or go travel to distances to use the public facility. And sometimes you
But
have to queue. So at least a toilet should be in your household.
but if you buy porta potty, you can solve that problem.
I wonder which lady in 21st century want to use porta potty. Your girlfriend comes to your place and so use it. Even the mother will discourage her from marrying you.
Nick,
Ronald,
you don't go talk.
Ronald, you not you.
You don't go
Even
talk.
the mother will discourage
Ronald,
her
you
from
not big time.
yeah.
You don't go kind of get safe.
Anyway,
Yes.
let's continue.
Yeah, so housing can also affect our educational opportunity. Yes, taking the Mahama project, for instance, in the central region, some of the schools were built far from the community. So if you are in that community and um, you would want to go to secondary school, and it's a day school too, so that can also influence where you live. Can also influence whether you can attain certain because in those communities they only have up to GSS, and there's SHS2 is day and it is far from them. And well, housing and food instability, access to healthcare, and all that. So stigma and discrimination. So well, recently people want to stigmatize you or discriminate based on where you live. There are people like that. It's so unfortunate though, but that's life. So we have housing and infectious diseases. So features of standard include, so they are, so clearly there are a lot of factors, but the common ones are lack of safe drinking water. So in ideal sense, maybe you may not have it in your house, but there has to be, at least safe drinking water around, like pipe or something, pipe, what we call pipe from Ghana water. And yes, then there should also be an absence of, is there? Yes. Well, if you don't have, in the ideal sense, we have to wash with hot water, washing plates and all that. But I think the soaps are also doing a very good job. And where you are in a location, or you live in a place where you don't have a proper channel for disposing waste. So ineffective waste disposal. Some places they do things and then they just dump it in the gutters. It's not the best because the household doesn't have a system for collecting the waste and disposing it. And people do all sorts of things. So if you also the house is also substandard when you have created rooms for like possible disease breakout or outbreak, by creating conducive conditions for disease vectors like insects, rats, cockroaches, and all have you. And also there's inadequate food storage. So you have to so in a house where we don't have proper ways of storing food, can also affect your health. So you're saying lack of housing and the overcrowding found in temporary housing also contribute to morbidity from respiratory infections and activation of tuberculosis. Yes. So one of the things we do is, when it comes to TB, is that um, we do contact tracing, and when we meet the case, we check the house and all that to make sure that the house is well ventilated. And also, we also want to see the number of people living in that house, and we want to encourage them to also test for TB, and we also educate them on how to all that. But unfortunately, when it comes to housing, and we are not, because a place like Choco, you have about 20 people in a small room, and you wonder where the others should go and sleep. And meanwhile, one person has it, the TB, and it's not just some 3+ is very dangerous one. Some even drug resistance, and it becomes an issue. So an overcrowding in an apartment, it's a major issue, a potential for outbreak in housing. So I don't know if you can relate with, they are actually not painting designs, they are not wallpapers, but I think you have fair idea of what has been shown here. What people call, is it cocomemory or something? Mold. Those green things on building.
Apotobibre.
Sorry, forgive me. And every man trying to speak.
Coco Blibli is the guy word.
No,
Blibli is
Apotobibre.
the guy word.
Oh, okay.
Apotobibre.
Okay. Yes.
Coco Mlemo.
I see you. I didn't say kokomemeo.
You said Potobibre.
Yes, so those things they are yes they are sources of infection for and they trigger allergies, asthmatic, and all that, chronic respiratory issues and sometimes yes heart problems as well. So dams provide a natural environment for mines to reduce respiratory viruses. Recession have also established associated with damp and moldy house and recurrent headaches. So sometimes you are there, could be headache, you are feeling feverish and all that. Some of these things can trigger them, vomiting, sore throats, nothing funniest. Yeah. So reservoirs for dusts, allergens, yes, as mentioned, exposure to this agent can result in allergic respiratory, neurological, hematological illness. Breast infection provide another linkage between housing and chronic, yes. So you see, I don't know if the jam, the sandwich came with cockroaches, but sometimes when we leave food, the unattended to, the cockroaches will do that to help do that for us. And you can imagine what they are leaving on the bread. So they come and you come and don't see the cockroaches around and just take it and ingest it. You can just imagine. So yes, so having cockroaches around can also trigger allergies like asthma. All that. So children with asthma who are sensitized and exposed to cockroaches are elevated risk for. So once you have them, you are likely to find more of them, or once people are exposed to these things in their homes, you are likely to see an increase in hospitalizations due to like asthma and all kinds of health conditions, both chronic and infectious diseases. Sometimes you don't have to look far, just their homes, and you know what is making them sick. Especially they come, you treat them, they go back, then they come again with that same issue, and you should begin to suspect if the person works. You can also suspect the workplace. But if the person doesn't work and it's mostly in the house, then you will also suspect the house in which the person is living. So deviation of indoor temperature beyond relatively known has been associated with yes, so temperature, living in cold housing can be associated with general health that increase use of health. Yeah, so this particular one is not so common with our because in most of the time our weather conditions or temperatures are not so cold but can be very hot sometimes. Sometimes, and the relation between lead exposure from so some I think they stopped, but I'm not so sure. But I think there was a campaign to stop people from producing paints with lead because it has issues. It has lead, and lead also once you're exposed to it has its own neurological issues, and it's very harmful to our health. So yes, asbestos once again, lung cancer and lead. So then how housing improvement can contribute. So now we've seen the problems. So we are seeing how housing improvement and reduction of aquatic habitats. I think this chart is easy to understand.
Don't
It
pass
is saying that
minutes
the
and
meeting we have 10 minutes. Oh, okay. Don't worry. So if you even have asbestos, you can think about fixing ceilings to reduce the contacts, and you have to your windows well cleaned. Should have a very good ventilation system, and you should try to eliminate every possible way that like vectors can breed in, like mosquitoes and what have you, like water and all that, or open gutter and all that, well cleaned. Yes. So yeah, we're also going to look at housing and injuries. The importance of designing homes, yes, especially with regard to reducing burns and falls. Attributes of substandard housing that increase the risk of injury include exposed heating sources, unprotected upper story windows, slippery surfaces, breakable window glass inside with, yes, poorly designed stairs with inadequate lighting, yes. So it's true that inadequate lighting can affect our health, but when the lighting too is high, with very high watts, it can also induce cancer. It can induce cancer. A study that was published, I think recently, found that cancer rates were higher in women who were exposed. Breast cancer was higher in women who were exposed to higher levels of light, what we call watts. So when the light in the house is too bright too, it can give you issues. So everything should be in moderation. So you have to check that no slippery surface, no breakable glasses. If there's any breakage, it should be dealt with as soon as possible. And there's this area, a building, they have it something. There's an area that is really receiving attention recently, and you know, it's not so common in Ghana, but it has to do with how we build. It's called built environment and health. So now you see that we have high skyscrapers, and we are seeing more like rising buildings in Ghana, like Accra. And sometimes I ask myself, so assuming there's a fire outbreak in a place like City House or Financial Center by Movenpick or some of these tall buildings, and clearly if you look at the kind of fire service machines we use, vehicles we use, I'm not sure they'll get up there. Even their stairs won't get up there, neither will their hosts get up there. So with these buildings, what are we doing so that in event of any outbreak and in event of issues, fire burning and all that, some of them, I wonder if they have those systems in place. So it's very important, and emergency exit so that there's enough air with this doomsday issues, because at certain heights too, some people may not want to create those tall buildings with certain windows. So building design and materials influence the risk of injury. So yes, if your building material isn't good, you can imagine like what happened in about I think 5 years ago. One Melcom, is it actually Chimota branch? One of the branches, yes, collapsed because I suspect it wasn't properly constructed, or maybe the building materials, and that caused their life. And we see some homes just collapsing like that. So nutrition, lack of affordable housing has been linked with inadequate, especially among children. Expensive housing may force low income tenants to use more of their, yes. So it's true. So a place like Accra, where it is required of you to pay 2 years advance as rent, and your income, a lot of things are competing for your little earning, and housing takes about 60-70% of your salary, and you're supposed to cover for 2 years, and you take loan, and this loan people decide to deduct. You realize that you have small amount of money to feed yourself for that period, and especially we've just finished school, and are just trying to put things together, because as you even rent, you need to furniture, you need to buy certain things. Meanwhile, a man too has to feed, and you have transportation also taking some of your money. So at the end, you end up spending little on food, and especially if you're a family person. And I remember one time when I was coming to school, after my mom paid my fees and everything and paid, and later on she had to pay rent, and there was nothing in the house. So for about 1 week, they were eating banku with only pepper, without fish or anything. And at a point in time, my my father wasn't used to that. he was brought up a Dadabi man, but the things became so hard that he had to be rushed to hospital. But who expected? Yeah, yeah. And temporary housing for homeless children often lacks cooking facilities, leading to poor, yes, nutrition. And so you're saying that housing and mental health, housing may also adversely affect mental health, although the evidence is more authentic. Excess indoor temperature has been linked with irritability and social intolerance. Damp molding, yes, crowding was associated with psychological distress among women aged. Yes, women, it looks like women want more privacy and space than men. You can have men, a lot of men sleeping in a small area, but women cannot tolerate that, the heat and all other inconveniences. So they are likely to have more issues than guys. Mm. So homeless and living in substandard temporary housing has been related to behavioral problems among homelessness and living in substandard. Yes. So once, yes, you don't have the house in the first place, you are homeless. And you have children. The children will be exposed to other lifestyles that you may have little control over. And they may misbehave if you are living in a single room and everything is in a single room
Hmm.
with your family. Yeah, and you and most of the time, oh, it is common, especially in the is it the James area? Is it the Jamestown area? Yeah, the Choco areas. You find that they end up, spending most of their time outside the room because the room is filled with their properties. So it's only in the night that they go and sleep in there. So you find that once that happens, especially children will be, have to be relating with other children that may have some um, attitude or behavioral pattern that may not be healthy or not may not be helpful. By the time you see they've acquired those behavioral traits and they are exhibiting them. But if you have a place where even within your area, your children can play without having to go and play with children that have those types of attitude that are afford, it can help. It's so standard housing conditions may lead to social isolation because substandard because occupants are reluctant to invite guests into their homes. Oh, that's sad. So some people they feel their buildings are so up to not there, up to standard. So they wouldn't want to even invite people to come and pay them a visit. They just said they are there in their small corner. So it's self-isolation. So high-rise building may inhibit social interaction because they lack common spaces. Yes, it's true. Okay. Okay. Oh, yes. So yes. So bringing it. So interventions for improving housing. So some measures have been proposed as a way for improving housing systems. And we have exposure assessment and consultation for individuals. So local health departments should offer indoor environmental quality assessment of homes through visual inspections, in some cases through quantitative measure of exposure to biological contaminants,